Hi everyone, Dr. Knackstedt. If you've been on social media or watched the news lately, I'm sure you've seen all about the GLP-1 medications that are being discussed for patients to help them lose weight. We've discussed before on this page about the implications for surgery, but I had a recent patient encounter that really highlighted those points, so I wanted to re-emphasize them. So GLP-1 medications mainly work, as our understanding is currently, by decreasing people's appetites and delaying gastric emptying. So when people take in less calories, they tend to lose weight. The challenge is that when you're on one of these medications, unless you're really emphasizing protein intake, patients tend to lose lean muscle mass. And if you're not doing resistance training while you're losing that weight, you also tend to lose lean muscle mass. So that's great that you've lost weight and your BMI is maybe in a more healthy range, but you have to be very careful with the loss of lean muscle mass that can also occur. Let's talk about a recent patient example. So I had a patient come to see me who was interested in breast reconstruction using her abdominal tissue, so that's called a free flap. My personal cutoff for that is a BMI of 35, and her BMI was close to 40. So I encouraged her to lose weight and then reach back out to me when her BMI was less than 35. So within a short period of time, like 6 months, she was able to get her BMI from almost 40 to close to 30. So that was a really significant drop in weight. And so I was really excited for her and happy that her BMI was in a safe range. She felt better, she felt more energetic, but my concern was what that really rapid weight loss, and I knew she wasn't working out, what that rapid weight loss did to her protein stores. So before we scheduled her for her free flap, I got some basic labs. I got a comprehensive metabolic panel, and I found that her albumin was 3.2. That's pretty low. When I'm doing a free flap, I want it to be at least 3.5, if not higher, because that's been shown to decrease complications. Why? Because we've just discussed so many times of how protein is important for healing and for recovery. So I was able to have a discussion with her about increasing her protein intake. We started her on a supplementation regimen, and we will proceed with her surgery as her albumin gets back to a normal level. But advocate for yourself. If you're on one of these weight loss medications, check your albumin. Even if you don't have a surgery coming up, have your primary care doctor order a complete metabolic panel and see where your albumin is. If it's below 3.5, you really need to step up your protein game and consider adding in resistance training to build your lean muscle mass. If you've had a surgery and you've been on one of these medications, did your doctor check your albumin? If so, let me know below.